Have you ever wondered if your body is trying to warn you about high blood pressure, but you just haven't noticed the signs yet? Sometimes it's not the obvious things like feeling off, it's small clues your body gives you, clues that could mean the difference between catching a problem early or facing a serious emergency later. So, today I am going to walk you through 10 high blood pressure signs you should never ever ignore, and I will also help you to understand what is truly happening inside your body when these signs shows up. Hi, I am Nicholas. I'm a pharmacy practitioner, and my goal is to help you take control of your heart health naturally and also safely. Now, before you panic at every headache or dizzy spell, I want you to really understand which symptoms are early warnings and which ones are red flags and which ones may have nothing to do with high blood pressure at all. So let us make this simple and clear, okay? Number one, severe headache. You know that pounding headache that feels like your head is almost exploding? Yeah, that's not your usual tension headache, okay? If your blood pressure shoots up very high, it can raise the pressure inside your skull, what we call intracranial pressure. It is the kind of pain that doesn't go away with your normal painkillers. That could mean a hypertensive crisis, which means that your blood pressure gets dangerously high, often 180 over 110, okay? And if that ever happens, don't wait it, okay? That's an emergency. Then number two, we have nosebleeds. Nosebleeds and blood pressure are often misunderstood. Most nosebleeds are not caused by high blood pressure. They are usually from dry air, allergies, or even low vitamin C. But if your blood pressure is extremely high, those delicate blood vessels in your nose can burst. That's when you want to take it seriously, especially if it happens suddenly and your blood pressure is up in that danger zone, okay? Number three, blurry vision. If your vision suddenly becomes blurry or fuzzy, don't brush it off. High blood pressure can damage the tiny blood vessels in your eyes, affecting how your retina receives oxygen, okay? But here is something important. Blurred vision is actually more common in people with type 2 diabetes and insulin resistance. So if you are noticing this, it is a good idea to get both your blood pressure and blood sugar checked. At this point, allow me to remind you this. I know the business of this life can make it hard to remind your loved ones to take their medications on time. Or maybe it's even you who sometimes forgets. That's why I offer a personalized medication reminder service to help you stay consistent and healthy. Through friendly WhatsApp messages or quick phone calls, I'll remind you or your loved ones to take their pills, refill prescriptions, and even keep track of blood pressure readings, okay? It is simple, caring, and pharmacist guided because every dose matters. So if you would like me to help you or someone close you to stay on track, just send me a message or a comment. Just write, remind me, and I will personally reach out to get you started. Number four, blood in urine. This one sounds scary, and it is. Blood in your urine can sometimes signal kidney damage, which high blood pressure can cause over time, okay? But honestly, the most common cause is usually urinary tract infection. Still, if you notice blood in your urine, don't guess, okay? See a doctor right away. It could be that your kidneys are asking for help, okay? Number five, fatigue and shortness of breath. People often blame this one on high blood pressure, but the truth is, fatigue and breathlessness usually come from heart strain or fluid buildup in the lungs. So when the heart can't pump efficiently, pressure builds up in your lungs, making you feel a shortness of breath even with light activity. So while blood pressure may not directly cause this, it's often part of the bigger picture of heart health, okay? Number six, ringing in your ears, commonly known as tinnitus. Have you ever heard of that high-pitched ringing in your ears? Most of the time, it is not blood pressure, it is stress. But if your blood pressure is very, very high, it can create turbulence in the blood flow near your ear, which produces humming sound. So if it is sudden or comes with dizziness or headache, check your numbers, okay? Number 7, nausea and vomiting. Now, this one is serious. If your blood pressure rises high enough to affect your brain, causing nausea, confusion, or vomiting, you may be in a hypertensive emergency or even at risk of a stroke. If this ever happens suddenly, don't wait for it to pass. Call emergency services immediately. Number 8, weakness or numbness. If one side of your body suddenly feels weak, your face drops, or you can't speak clearly, that's stroke, not just high blood pressure. Hypertension increases risk of stroke, but in that moment, it's not about your blood pressure reading, it's about getting urgent help. Call an ambulance. Every minute counts. Allow me to remind you this once more. I know the business of this life can make it very, very hard to remind your loved ones to take their medications on time, or maybe it's even you who sometimes forgets. That's why I offer a personalized medication reminder service to help you stay consistent and healthy. Through friendly WhatsApp messages or quick phone calls, I'll remind you or your loved ones to take their pills, refill prescriptions, and even keep track of their blood pressure readings, okay? It's simple, caring, and pharmacist guided because every dose matters. If you'd like me to help you or someone close to you stay on track, just send me a message or comment, remind me, and I'll personally reach out to get you started. Number 9, chest pain or pressure. Chest pain or angina happens when your heart muscles don't get enough oxygen. It can feel squeezing, pressure, or heaviness, especially during activity. High blood pressure doesn't directly cause chest pain, but it wears out your heart over time. If you ever feel chest pain, even mild, treat it as emergency. Number 10, dizziness, confusion, or anxiety. Have you ever stood up too fast and felt dizzy or lightheaded? That's often from low blood pressure, not high blood pressure, okay? But if you experience sudden dizziness, confusion, or trouble focusing, especially if it's new, that could mean your brain is not getting enough oxygen. Sometimes it's a mini stroke, also known as transient ischemic attack, which is an early warning sign of a full stroke, okay? So again, don't ignore it. Your body is sending you signals, so listen to them. Here is what most people miss. High blood pressure doesn't usually hurt until it causes a serious damage in your body, okay? It is called the silent killer for a reason. So the best way to catch it early isn't to memorize the symptoms, it is to measure it. Well, here is a bonus tip. Honestly, for just a few bucks, you can get a home blood pressure monitor. Make it part of your weekly routine, maybe every morning before breakfast. If you see numbers like 160 over 100 or higher, pause, sit down, take deep, slow breaths. If it doesn't come down after a few minutes, that's your reason to seek help, because sometimes your life depends on catching it early, okay? If this video helped you to understand your body a little better, that's a win. If you want to get deeper into how blood pressure, metabolism, and lifestyle all connect, I have got plenty of videos for you. Tap subscribe, hit the bell, and stay connected. Together, we will all make sure your heart and your health stays strong for years to come, okay? Well, take care of yourself, and I'll see you in the next video. Bye.